Do you get tired sometimes working at the computer? Does it feel like your hands weigh a lot more than they should, just holding them to the keys? Or do you find yourself getting fatigued doing any repetitive activity with your upper extremity? That's a really critical thing to listen to. Fatigue is important. It's one of the warning signs of repetitive strain injury. And here to explain fatigue and why we should pay close attention to it, and the role of sleep, which is another really important factor, is our chief medical expert, Dr. Robert Markison. Welcome back to the show, Dr. Markison.
I'm not the paragon of great sleep because as a surgeon in training and subsequently you learn to sleep little brief segments and catch up on the weekends. But having said that, sleep is restorative and enormously important. You don't want to oversleep and you don't want to undersleep. Everybody has a circadian clock. It runs 24 hours. It's taken care of in terms of the inner workings of the suprachiasmatic nuclei, which are little nuclei in the back of the brain that are your actual clock. It's very interesting. So plus or minus 10 minutes, whether you're sighted or blind, you will have a clock that tells you what time of day it is. Some people do very well on their clocks and some people do poorly, and they hurt themselves by not understanding their clocks. If you look at Beethoven, he woke up and got ready at 7:30 in the morning. He had his little cup of coffee. His manservant counted out the beans, everything perfect. 7:30 a.m., he composed for eternity. He didn't compose it at 10, 11, or 12, or 2 or 3. That was when perfection happened, the light quartets, 7:30 a.m., Beethoven. Everybody should know his or her clock. It's not a big deal. For me, I know exactly when I should do surgery. I know when I shouldn't do surgery. I know when I should talk to a patient who's very difficult with a head full of questions and when I shouldn't. If I know anything from having worked around the clock, I know my clock. No, the overlooked problem is sleep apnea. So if anybody ever tells you you're snoring and or you wake up and you've got air hunger, then you may have sleep apnea. And sleep apnea is really the thief, the culprit, the person, the entity that steals your good health. And so if you have even a hint of sleep apnea, you should get a little sleep study called a polysomnogram. It's no big deal. And in fact, sleep apnea can be the harbinger of hypothyroidism. And I've had a number of patients over the decades whose hypothyroidism presented as polysomnography diagnosed sleep apnea. So if you have even a little sleep apnea, your prescribing professional writes a prescription for CPAP, continuous positive airway pressure. If you're a nose breather, you use a little nose mask. If you're a mouth breather, a fuller mask. And you get it set up properly so that you can get a wonderful sleep, expand your lungs, feel great. Many people have less gout symptoms, less arthritis. Average weight loss in 6 months is 5.6 pounds. All the metabolic stuff, including cholesterol, starts to fall into better line when you have restorative sleep because you don't have micro collapse of lungs, the airways, the alveoli. And so you want to have fresh lungs. Anybody who has even marginal sleep apnea should consider CPAP on 2 counts. 1, restorative sleep that will refresh all of your waking hours in repetitive motion. But 2, in this current COVID pandemic, the lungs are the most potent generator of cytokines, which are the inflammatory mediators that cause inflammation to ramp up and go out of control. Those who are CPAP compliant with sleep apnea do much better, greater survival statistics, lower levels of, quote, long COVID. So it's not only general function, refreshment of all tissues with adequate oxygenation, but it's immune safety.
There's one other question that I have, because I understand the role of restorative sleep. It really is important in, sort of the cheapest medicine, and sometimes I think the best medicine for whatever ails you. But there's also another kind of fatigue, and that's more mechanical, if you will. It's more the action. It's not because you didn't get a good night's sleep, it's because you're overdoing. And I think a lot of people tend to push through that fatigue, to ignore it, to say, I'll take a break later, rather than really taking it. I think it's a very serious indicator myself. I've had personal experience. I think that's why I got RSI, as I was pushing through fatigue, mechanical fatigue. So what do you have to say about that? Anything?
Well, absolutely. Obviously, there's a nested set of clocks in microcosm in tissue, and you can't exceed what those clocks are going to do in terms of refreshment, metabolic function, and mitochondrial bioenergetics in those little cells. If you're pushing too hard and at a tiny microcellular level, not making enough energy to keep up with it, then you're going to have kind of negative inflammatory mediators. They're not going to be discernible even by electron microscopy. You're not going to find lactic acid in the tissues with a micro sampling, but you're going to overwhelm your ability to keep up. So you really shouldn't, it's not no pain, no gain kind of stuff with repetitive motion. It's the same with my prodigy musicians, and I've treated legions of them over 4+ decades. How do you practice? How long do you practice? Oh, I practice 1 hour. I'll say, well, why don't you practice 20-minute segments 3 times a day, recording each and listening back in real time? You'll get better, faster, be stronger, longer. So if I, for example, take up something new, like a musical instrument, I play for 5 to 7 minutes, self-recording it, do the same thing 3 or 4 times through the day. That's it. Then I keep the archives fresh every 6 months, maybe 15 minutes worth. But if you videotape on your cell phone with audio how you're typing, and you hear that it's an irregular sound pattern, you could look at it in any of the many free softwares to watch a waveform of the sound of your typing and the amplitude of the wave. Then you realize, whoa, I've really overdone it. Not only speed, but percussion. I'm too noisy. So if you're going to go, and you must go, then the difficult, almost cognitive dissonant way to do it is, the faster you go, the less effort you want to expend. So hitting your keyboard is not that. It's a leaf on a pond in autumn. It's something settling, even in rapid motion. And you watch a fabulous violinist doing rapid passage work, moving the bow across the strings, and it's effortless. It's just almost zero gravity. They're not banging a bow on strings. It would sound horrible and scratchy, nor
Yeah.
should you bang or overgrip anything. So you don't want to overwhelm your capacity to generate raw energy at a mitochondrial level in the cells, because you're going to pay a price for it.
There's something that you're saying about the mitochondria. You can't see it, you can't test for it, it's too small. You're not going to have a lactic acid buildup. But one thing that I think you can rely on, if you're sensitive and looking, is your own felt sense of, gosh, I'm getting a little tired here. And to me, that seems like a really good thing to be listening for and honoring by stopping, as you said, taking a break, taking a listen, thinking instead of looking over what you've written or looking over your work rather than hammering at the keyboard. What do you think?
No, I agree, and absolutely. And as you know, the great pundits of time have said, I'm sorry I didn't have time to write you a short note. And then you expound, and you've got some horrible long text that nobody is going to read for lack of attention span. And so Shakespeare was right. Brevity is the soul of wit. If you can boil it down to a few punchy, meaningful, maybe archivally meaningful thoughts, then you're done. If you bloviate, then you've made a mess on both sides of the words.
So in the interest of not bloviating, I think we'll stop here, but I want to thank you so much, Dr. Markison. As usual, I've learned something. You've made us all smarter. And thank you so much for being our expert.
Thank you.
And remember, everybody, that you need to take care of the hands that you have, because you can't use your other pair of hands to do what you want to do.